Breast cancer is the second leading cause of death in women after lung cancer. Over 10,000 cases of breast cancer are reported in Nigeria annually. Experts say not all cases of breast cancer should lead to death, but the leading difference in cases of survival rates of breast cancer is early detection. This is the Amazons. We'll go on a quick short break now. When we come back, we'll expand the discussion. We would introduce our guests who are experts in cases of breast cancer. And of course, you can always join the conversation on our social media platforms. After the break. Welcome back to the Amazons. My name is Aisha Faludi, and my co-anchor, the ever vivacious, beautiful Lillian Imoni.
I'm blushing. Thank you so much. The forever young looking, gorgeous, radiant Aisha Faludi. Thank you so much. Remember that you can be a part of this discussion by joining us on our social media handles. On Instagram, it's the Amazons Official NG. On Twitter, it's the Amazons NG. And on YouTube, it's the Amazons NG. Thank you very much.
Yeah, Lillian, today we are talking breast cancer. Breast cancer is said to be the second leading cause of death in women. It is a serious issue. I mean, if they say that self-examination, early detection can be the difference between life and death.
Sure.
Why do we still, as women, still find it difficult to do that self-examination that could actually help?
Like I said backstage, this issue cannot be overemphasized or overflogged. I mean, it's a major public health issue that is responsible for the death of 1,000 Nigerian women and, over 1 million across the globe. I also think that one of the major issues here is the average communication channels, that hardly filters through to rural communities where most women are affected. And in other cases, some women, are negligent. They are also ignorant of what you just said, self-examination. They wait until there's a lump the size of a lemon before, red alert. Everybody's screaming, running helter-skelter. But self-examination and early detection is very key. Very, very key.
Yeah, I also think that, you see, even though they've said self-examination, early detection can be the difference between life and death. A lot of us we still want to hold back that, look, what I don't know will not kill me. If I find out if I find out that I truly do have a lump in my breast, even it may not be cancer or it may not be cancerous.
Any kind of lump, true.
That the fear alone, the anxiety alone would probably kill me faster than the cancer itself.
Very true.
So why don't I just leave my body the way it is? The day it comes, I'll deal with it. You see, that is coming from a point of ignorance.
Ignorance.
What you know will not kill you.
It's what you do not know.
Even when it does kill you, there's a probability that you may survive it. But what you don't know, ignorance
is what will kill you.
Is what will kill you. So why don't you take the bull by the horn? Self-examine. And they've taught us how to do this thing
over time.
How to do it. Maybe, I truly don't know how we can get women, both the rural community and in the cities, to do this self-examination.
This is the place of, education, constant, education about, how to go through this self-examination. The mental state of these women, like you rightly said, some of them are scared of the unknown. Maybe we should be educated that, look, it's not about finding out that there's a cancerous lump in your body, but just so you know your mental, your state, if you're safe, if it's okay with you. Maybe we should be educated properly before we start the self-examination process, so that every woman out there will be bold enough to walk into a clinic and say, hey, I want to check this, I want to check that. So it doesn't look like, because I also feel that this self-examination gospel that is being preached, the women receive it as some form of, scary news. Like, hey, self-examination. They feel like if they are checking themselves, there's already something wrong. They feel like, for me, do you understand what I'm saying? Like, self-examination. beg, let me leave my body like this, you know, that kind of thing. So if there's proper, constant, consistent education on why you need to take that self-examination stage seriously, I think we'll go a long way.
I think information can never be too much.
True.
It can never be enough. It can never be sufficient. We just have to keep pushing for people to be aware of their body. You know, the DIY costs you nothing. Do it yourself.
Do it yourself.
Just as you would DIY a lot of things and fix a lot of things in your house. Your body, first of all, and your health should be paramount to you, to your family, to your loved ones. Because once once you're gone, that is the end of it. So if there's something you can do yourself to delay or deny death from coming, we know that it will come when it will come. But it should not be for the reason of something you could have done. That's why now everybody's embracing lifestyle, you know, eat right, jog, exercise.
Fitness buffs and all of that.
You understand? Because you should take care of your body. We will call for another quick break. When we come back, we will meet our doctors, because we do have doctors in the house. You know, on the Amazons, we don't just talk. We bring the experts who come and throw light and educate us them out on the topic that we discuss. Today is breast cancer, the second leading cause of death in women after lung cancer. After the break.
So the fact that you have a breast means that potentially you can have breast cancer. It's more common in women, but it do occur in men.
And you know, the unusual thing about screening that way is the doctors will be checking, they'll be,
You think now they've seen this cancer?
The anxiety is so horrible.
Welcome back to the Amazons, where today we are discussing a very sensitive issue that concerns women. And we have our guests with us who will be throwing more light and more depth into the discussion of breast cancer. Dr. Emeka Omose is a breast cancer surgeon. And of course, we have Joanna Adeyileka, who's lost close friends to breast cancer, and she also had a scare which turned out not to be breast cancer. My first question is to Dr. Omose. Dr. Omose, really, what is cancer, and what is the cause, or are the causes of breast cancer?
The cause of breast cancer is not known, actually. What we know is there are some factors that can predispose a woman to breast cancer. And the fact that somebody has a breast means that the person potentially is at risk of breast cancer. It's more common in women, but it do occur in men.
Oh, really? Men do have breast cancer?
Yes, men do have breast cancer. In this year, I've seen 2 cases of men with breast cancer. So the fact that you have a breast means that potentially you can have breast cancer. But because the size of the breast is bigger in women, it's more common in women than in men. And the cause, we say, is not known, but the emphasis we place is early detection. That if you can get it early, it can be cured. And that's the emphasis on early detection, doing your own self-breast examination, which to advise that it should be at least once a month. And most women have a bit of pain, a bit of tenderness in their breast during their period. So it's usually advised you should do your self-breast examination about a week after your period, when the breast is less tender and less engorged. And the technique is usually simple. You can either do it lying down, or you can do it standing up in front of a mirror. And you try to cover the whole breast, either by doing a circular motion or a longitudinal motion, any one that is more convenient for you. And then the other one is, if you notice a lump or you notice anything at all, see a healthcare practitioner. And the common symptoms you can have is, commonly most women complain of pain in the breast. There's a pain here, there's a pain here. Some pain are what we call fleeting pain. It's not in one place. It just says here today, tomorrow the other place, the other place. Once you're worried, see somebody who can examine the breast and tell you whether there's any problem or not. The other symptom you can have is a lump in the breast. Of course, a woman knows now that once there's a lump in the breast, there's an alarm.
Sure.
It's like a trigger. But fortunately, most of the lumps are what they call benign. They are non-cancerous, which means more than 80% of lumps in the breast are not cancer. They are just a lump that is there. But now the onus is to know whether is it a bad one or a not so bad one.
How do you differentiate between the lumps?
Normally with the lumps, clinically, what you look out for is one is the lump that is mobile, what you call the breast mouse. It's going all over the place. It's likely not to be cancer, because most lumps that are cancer are fixed. Either they are fixed to the skin or they are fixed to the deeper structure. So once you have a lump that is fixed, the first thing we think is it's not so good. It might be cancer. The other thing you look out for is also a discharge from the nipple. So sometimes you press your nipple, something comes out. For most women, it could just be a benign thing. It could just be like a watery fluid. Sometimes it could be like a milky fluid. Sometimes it could have a blood stain. Once it's blood stained, that's a red flag that something could be going on. It doesn't mean that it's cancer, but most of the cancer that presents with discharge from the nipple has some blood in it. So once there's blood in the nipple, we ask you, see a doctor. It needs to be properly investigated. When you have a lump in the breast and you notice a lump in the armpit, that's not good.
Okay.
Because
so for Joe, you've been, you've seen cancer, and then you've also had the scare. In your own case, in your own experience, how did you discover what you thought was cancer? And how did you now know that whether the lump was not, it wasn't a bad one. It could have been benign, just like Dr. Onwosu said.
Okay.
Sorry, and most importantly, what was your first reaction?
From the age of 50, overseas, I have a breast check every 3 years. And just this year, I went for my breast screening test. And I came to Nigeria, I thought, everything has been well. All these years, surely it's going to be the same. And I got a call to say there's been a difference in the picture shown 3 years ago and previous to that to the one I did this time. So they want to do some further investigation. Now, that period between reading that and going for this, deeper screening, I saw me qualifying, going to school, having my children, getting married. I went through the whole process of my life and I said, is this how death happens? Is this it? And I went there and they took all my details again, asked me some history, went through another 3D screening, and thereafter I saw the consultant. He did the physical check on both breasts, and then I had a scan. And the unusual thing about screening that way is the doctors will be checking, they'll be,
You think now they've seen
the anxiety is so horrible. You'll be saying to yourself, okay, I've accepted.
You see, that could have been the reason, Dr. Onse, why a lot of women would want to run away from this self-examination, even though we know that it can be life-saving. It can also, the anxiety alone of saying there's something that shouldn't be here that is here. If I don't know about it, then I probably will just go about my normal. But if I know about it, the anxiety alone becomes another health scare for the patient.
That's true. What you commonly advise them is it's better to know. If you know, I say I don't want to treat, I don't want to do anything, that's better. But to wallow in ignorance is not the best.
It's more expensive.
It's more expensive, yeah.
True.
Definitely.
So the self-examination,
Yeah.
either lying down or standing up, it can be done while sitting.
It can be done while
It can be
sitting.
done. Okay, so do you have to take all your clothes off, or even as I'm sitting now, can I self-examine? Can I do the self-check?
Well,
with my clothes on.
It's better to have your clothes off. Better in the comfort of your room, or in the toilet, or the bedroom, or wherever you want to do it. The blouse off, the bra off, leaving the breast exposed. And then, commonly, if you are lying down, we advise, if you want to examine the left breast, to extend your hand up like this. In that way, you flatten the breast. Because some people are more endowed than others.
True.
So once you lift up your hand, the breast spreads out a
So
bit more.
do your self-examination.
That's what I'm trying to do.
You spread it out more.
Okay.
Then you can, if you examine the left, use your right.
Okay.
If you examine the
Right.
use
your
left.
left. Okay.
So I'm examining my left now. So I can start from the nipple,
Okay.
going on a circular
motion.
so you don't miss any spot.
Okay.
And usually use the palm of your hand.
Okay.
There,
Of
not
your
That's
fingers.
here.
Yeah.
The palm of your
here.
fingers.
Okay.
The palm of your fingers.
Okay.
Like this.
Okay.
Going round.
A circular
round,
motion.
Circular motion
Okay.
until you cover the whole breast.
Oh,
and when
I
you have
see.
finished, you examine the armpit.
How do I examine my armpit?
With your hand like this.
Same circular motion.
Circular motion to your hand.
Okay.
Flat like this, and then you dip with your finger.
My thumb,
Dip into
I dip.
firmly into
Okay.
the armpit.
Okay.
And then you scroll backwards like downwards like this.
Oh, I
So
see.
if you feel anything there, then you might not be able to know what it is, but at least you feel there's something there. And commonly what we advise is that if you do it regularly, once there's something different, you will
know.
notice.
True.
Maybe not, maybe nothing, but there's something different.
Okay, so for the early detection, how does that save life? What is the treatment? Okay, now it's confirmed that this is cancer here. So how do
if you
now?
pick it early, so by breast examination, the other one is the screening mammography. That you have nothing on your breast. Once you're above the age of 50, some people say 40, you should start doing mammogram. Once you do a mammogram, the radiologist looks at the film. Commonly what you see is some what they call microcalcification, like small white dots. Depending on the way they are arranged, it could be good, or could be bad, or could be not so bad. Commonly they grade it from 1 to 5. 1 to 2 is usually benign, what you say benign. 4 and 5 is commonly regarded as could be cancer. 3 is you're not too sure. So once they see a 4 or a 5, they'll call the patient back. Hey, there's something, we saw something, we're not sure what it is, we need to look at it more. So when you come back, that's when they can do a 3D mammogram, or sometimes what you advise is to do a biopsy. But because sometimes you cannot touch the lump, there's no lump in the breast, so you can't touch anything. But there's something suspicious. So what we advise is to do a biopsy. We call it a stereotactic biopsy. That means you do the biopsy using the mammogram machine. Because since you cannot touch it, you can't just biopsy any part of the breast. So the machine will tell you the exact spot, and with a guided needle to take a sample from that spot, and then it will tell you it's bad or it's good. If it's good, fine, say fine, that's the end of it. If it's bad, then you have to proceed to do more tests and then decide on what the best option for managing that particular case.
So at what point does the treatment for cancer start, for breast cancer, when you say you go for...
What are the treatments, you know,
So now once there's a suspicion or there's a lump that you don't know what it is, the first thing is to confirm.
Okay.
Is it cancer or is it not cancer? That's the first step.
Good.
And commonly it's done by biopsy. Either use a needle biopsy or an open biopsy. Commonly these days we prefer a needle biopsy because it's easy, you can do it quickly and get the result within a week, 2 weeks, depending on the laboratory that you send it to. So you stick in a needle, get a small, maybe 2 millimeter or 3 millimeter specimen. Commonly when we're doing a biopsy with a needle, we do multiple biopsies. Because you have a lump like this, you need to take from as many sites as possible so you don't miss anything. So it comes back and says that it's cancer. Then you have to talk with the patient. What are the options? The options are surgery. It could be drugs, which is called chemotherapy.
That's
Then
what
it
I
could
was
be
trying to remember.
radiotherapy. Radiotherapy means using heat to burn off excess tissue.
Okay.
With the surgery, there are options for surgery. Option could be just to remove the lump alone and leave the breast alone.
Okay.
Normally for early lesions or lesions that are very small,
Small.
you can do what they call a wide excision.
Okay.
Commonly what we do is you must give at least a minimum of 2 millimeter margin
Okay.
or 3 millimeter margin around the suspicious area.
Okay.
So what it entails is that if you are well endowed, when you take 3 cm around, that means you are looking at 6 cm easily. And when you remove, the breast can still be look
Perky,
okay.
a little bit perky.
Look okay. So if it's a small breast, by the time you take 6 cm, you can as well take out the whole breast. That's why I take out the whole breast. And also, for you to do the wide excision, you must have an effective radiotherapy, which is something that we are lacking in this environment. At the moment in Lagos, there's only one functioning radiotherapy. The other one has been more or less going up and down. So what it means is like, to get a radiotherapy, you might have to book 2 or 3 months in advance. So how can I ask you to go and join the queue?
Especially when it's not detected early.
Exactly.
So even when it's detected early, 3 months is a long time to waste.
Exactly. So that's basically one of the challenges that we have. So for the other option is to remove the breast, which called a mastectomy.
The whole breast.
The whole breast, which is another option. The only thing is that most women are reluctant
To take, of course.
to take out the breast.
Of course.
Unless, so it requires a lot of discussion to be convinced.
Convincing. Yeah.
Then
So what
family-
informs, this taking out the whole of the breast? And this brings me to my final question to you, Dr. Nwose. I understand that there are stages of this breast cancer.
Yeah.
What are the stages and their significance?
So we have what they call, normally they have stage 1, 2, 3, 4. 1 by its name means early.
Okay.
Stage 4 means advanced.
Okay.
And what makes the staging is 1, the size of the lump in the breast. Any lump that is more than 4 cm is required as big. In this environment, most lumps are bigger than 4 cm.
Wow.
Once that lump is attached to the skin, it's taken as advanced, no matter the size.
Okay.
If the lymph node in the armpit is enlarged, it's taken as it's called advanced.
Okay.
If you are spread, of course, you have gone elsewhere, it's taken as advanced. So most of the one we see is a bit on the big side with the lymph node affected. We call it advanced disease. So those that are more than 4 cm, we normally don't go straight to do surgery for them. We give them chemotherapy first to downsize the lesion, and also take care of the spread. Then after that, then we can do surgery now. Then after the surgery, also go ahead and do more chemotherapy for them.
Thank you very much.
No, sis, just one final question. For the advanced one,
Yes.
after you've done all this,
Yeah.
there's still a chance of survival?
Yes. We talk about 5 years survival rate, because basically you cannot say you are cured. So after you finish all the treatment, I have finished all the chemotherapy, we have to be doing checkups. If after 2 years there is no reoccurrence of symptom, we are normally after the surgery and the chemotherapy, you normally put them on hormonal therapy, depending on their reception status. Commonly, tamoxifen is the most commonly used, or aromatase inhibitors. So we give them for 2 years. And normally in that 2 years, we advise them that they should not get pregnant, because pregnancy is like a fertilizer for the tumor to grow. So should please avoid pregnancy for 2 years. Then after 2 years, then you start seeing them probably every 6 months until after 5 years. If after 5 years there are no reoccurrence of symptoms, you can tell them, fine, you are okay.
Can I just ask one question,
Yes,
please? Is it a myth or is it a fact that women who breastfed their children are less likely to have cancer?
It has not been proven because, like the factors associated with breast cancer, there are plenty of factors, and commonly it's done by statistics. A doctor pulls out his list of patients and says, I find out that those who have this are more at risk than this, but there's no scientific explanation why it should be done. There are many theories about it. Right?
And also a lot of women who have had a mother, an auntie, a sister who has had breast cancer. Does it mean that they are at higher risk?
Yes, they are. That is scientifically proven because it can be transmitted genetically. And that's why we are doing this BRCA1, BRCA2 gene. There's a gene that has been noticed or has been demonstrated to code for breast cancer. And that's what is thought to be that family transmission. So if your mother had breast cancer, what they commonly do advise is to do the gene. If you have that gene, BRCA2 gene, then you are 4 times the risk of breast cancer than normal population.
Thank you so much, Doctor,
for
joining us. That's been the program for today. And I'd like to thank our guest, Dr. Emeka Muse. Thank you so much for coming.
Thank you so much.
Joanna Ideileka, always a pleasure to have you on the set of Amazons. Until we'll see you again next time, Lillian, it's time to say goodbye.
It's time to say goodbye, and remember, the best way to beat breast cancer is through early detection. Bye for now.
Thank you so much